a live stream interview. We haven't done these for a while with the the decrease in COVID cases and life in a lot of ways returning back to normal. But we're back now to talk about COVID because it's been a lot in the news recently. There's been a surge in cases in at least 49 states. A lot of talk about the Delta variant. So we have on the line today Paul Pettit, the Public Health Director, to talk about some of these issues going on and tell us what's going on locally. So,
all right. Yeah,
Paul,
good,
how
good
you doing?
afternoon.
Good.
Yep.
Good.
Nice to be with you this afternoon.
Appreciate your time, Paul. I know as always you're busy. Although I imagine not quite as busy as you were, say, this time a year ago.
Well, I guess that's all in how you view it. Although maybe COVID activities and related response things are a little bit lighter than they were, especially going back over the last 7-8 months. It's an opportunity where we've been able to start engaging in some traditional public health work that we kind of haven't really been doing a lot of over the last 18 months. So, COVID related, yes, down a little bit.
Great. Well, let's first of all just clue us in, give us the numbers. What's been the trend here the last month or two, and kind of where is that trend going? What are we seeing in cases locally?
Yeah, so as you mentioned, COVID's been down as far as the activity and the numbers that we've been seeing. This decrease is very reflective of what we saw last summer. I think if we all go back a year ago, we saw all these cases, and when it started in March through April, May. Then we got into June, the caseload started to decrease. And in July and August, we had very little activity here locally in Genesee and Orleans County. So that is very similar. Our cases really started to tail off towards late May, early June. And over the last month and a half or so, we've really seen very little activity as far as new positive cases, to the tune of we're down now to getting anywhere from 2 to 5 cases per week. If that. We've had several days in a row where we've had 0 reported cases. So, it's kind of ebbed and flowed a little bit. The last week, we've seen a little bit of an uptick. If you've been following along with our active cases, currently we're sitting at 5 in Genesee County. So those are folks that are active cases on isolation, active disease. So at one point, I think a week and a half ago, we were down at 0. So again, we do expect to see cases. We expect to see clusters, small ones within homes, especially of those different homes where the folks are unvaccinated or a certain level of them are unvaccinated. That's where we're seeing most of our cases. We haven't seen a lot of breakthrough cases locally. And when I mean breakthrough, these are cases where people are fully vaccinated. The majority of the cases that we have had over the last month and a half are those folks that are unvaccinated. We do expect to see these breakthrough cases periodically. Again, we know the vaccines are not 100% effective. Anywhere from, depending on the J&J, at 60, 65% up to the Moderna and Pfizer at 94, 95%. There's still obviously some level of cases that will have been fully vaccinated. The good news in all those cases, the breakthrough cases, those folks were either asymptomatic and or very minor symptoms and had a very a decent course of disease, I guess.
So we'll talk more about the vaccinations, but let's. I want to talk about the Delta variant. What can you kind of explain to us what that is for those of you just kind of hearing it in the headlines, and are we seeing that variant locally?
Yeah, so the Delta variant, as you mentioned, has been in the news quite a bit lately. We've gone through different iterations of variants over the last 6 months, and we've seen different ones kind of come to light internationally, and where we've brought them forth as concerns. And the current one, as you mentioned, is the Delta variant. Just in general, variants, are of concern. I mean, they're basically modifications, mutations of the original virus. And, with that, the virus mutates and it adapts and it changes. And, those variations in the virus makeup, could create a situation where they're more infectious. So that essentially means it's easier to spread, right? So instead of potentially one person getting infected 1-to-1, that one person that's positive may pass it on to 3 or 4 or 5 people much easier. It's much more contagious, easy to spread. The bigger concern, even on top of that, is severity. Sometimes with these different variants, there may be more severity, and it could alter and change of those that may be at highest risk. for folks. So the other area that is of concern is how well do the vaccines hold up. So we do have COVID-19 vaccines. As new variants come on board, we have to see and test to see how well they hold up and how well the antibodies are against these new variants. I can relate it similarly to influenza and the flu. Every year we recommend people get a flu shot. And the reason for that is there's new variants, new strains that come out, and we need to get revaccinated to protect ourselves from those strains. So we're very early, obviously, in the COVID-19 and understanding it. As these variants come across, it takes time to understand them and determine, if they're going to take hold, and something that we really need to be concerned about. And then, again, what is the how infectious are they? What is the severity, and how well do vaccines that we currently have hold up? With that being said, the Delta variant is a variant of concern by the CDC. So as I mentioned, one of the things the CDC does, and the World Health Organization, is they look at these variants and try to determine, again, is it something of concern? And currently the Delta is. We do know that the Delta variant is moving throughout the United States right now. It is taking over as the most identified strain of COVID currently in the U.S. We have seen Delta in the region. So we do know that it is around, and we do not have any confirmed cases in Genesee County, although the expectation and understanding is that it is here. So it is something that we're watching, and it's really reiterates and hones in on the point that we need folks to continue to seek out vaccinations, because what we've seen so far with Delta is that the vaccines are effective. We're still studying it again and trying to learn more about it. But being vaccinated is definitely your best defense against the Delta vaccine right now. What we do know about the vaccine and what we've seen is it is much more infectious. So going back to what I mentioned, that is a concern that we have. It can spread easier, so to folks that especially are unvaccinated. So what they're showing with the early data, traditional COVID, one person usually would infect 1 to 2 others potentially. Delta, they're showing can infect 3 to 4 others from one case. So again, much higher infectivity, which is obviously a concern. There's also early indications showing some more severe disease course with the Delta variant, especially in seniors and those that are immune compromised, are traditional ones that have more severity with COVID. We're seeing increased hospitalizations and deaths, again, particularly in the unvaccinated. So again, we're continuing to monitor it, and we do again expect to see more and more of that circulating. I know they're seeing a lot of the Delta variant downstate, Hudson Valley, New York City area. That's the primary type of COVID vaccine variant that's spreading down there.
Well, thank you, Paul. I find it interesting. It hasn't reached us yet. I would have kind of maybe expected that it would have.
Yeah, like I said, I think we're pretty comfortable saying it's in our area. Like I said, it's been isolated in throughout the Western region. Part of that is not every case goes for stereotyping to see what type of variant it is. Wadsworth Lab in Albany does do that type of test. But again, it's kind of more of a random sampling. So the folks that we get back that are positive, those tests didn't necessarily go to see what type of variant it is. So could be some of these positives we have now could be Delta. We just don't have it isolated out that way yet.
For people wondering about the course of the pandemic, what's the do you have any kind of projection of whether we're going to be seeing masks again? Some of the restrictions on businesses that we saw before. What do you think people can anticipate in the near term and then heading into the fall?
Yeah, it's a great question. I continue to get that quite a bit. That's one that everybody wants to know. Everybody wants us to be able to look into that crystal ball. And it is a little bit too early to predict, I guess, where the state will be going as far as a mask mandate or some variation there of it, in addition to business restrictions, regulations, that we saw. I think, again, the key here is how well as a community are we doing with, our vaccination rates and our caseloads. Again, the lower we can keep those, the greater vaccination rate, the higher protection we have as a community in general, the better we'll fare when we start to see some activity. I think all expectation is we are going to start seeing more cases as we get back into late summer and the fall, similarly to what we saw last year. The difference being this year, we have a tool, right, to confront COVID and to try to deal with, keeping people from getting sick, and that's the vaccine. So, we're not sure where it's going to end up. We continue here locally, through our health department and many health departments around the state, continue to advocate and look for, autonomy when it comes to some of these decisions. We've talked about this in the past, even on the school setting, where we'd like to see some more local autonomy and decision making around some of these mandates and masking restrictions, especially because we know different areas have seen different activity at different times, right? So if we aren't seeing a significant issue in Genesee County and there's a significant issue in Albany at the time, should we be placed under those same type of restrictions? So it is early to predict. We are closely monitoring that. What I will say is, the more we can do now, the more folks that get vaccinated and build up our general community level of vaccination levels, the better we're going to be going into the fall and not having cases and making sure we can reduce the spread as much as we can, in hopes that we can, avoid hopefully statewide mandates, if it comes to that. Currently in New York State, and this is out there now, in general, New York State is still currently requiring unvaccinated folks to wear masks indoors when they're unable to maintain social distance. So we still do have some mandates in place in New York State, even though we've somewhat returned to a lot of sense of normal, and there's somewhat of a feel of that in the community. There still are some mandates that are in place and that are recommended by the CDC and actually in current requirement by New York State.
Great, Paul, thanks. This is probably some, kind of overlap information, but as long as we're talking about the fall, kind of what do you think parents, teachers, school administrators should expect at this point?
Yeah, another question we're getting a lot of lately here, right, is schools. And we've heard from a lot of parents, and I continue to talk with our local and superintendents on a regular basis. Obviously we're planning for the fall. The biggest challenge we have right now is the state continues to lag and not provide us with the upcoming guidance for the school year. We've been asking for it. As of the other day, when I was on a call with the state, their answer was they're working on it and they hope to have it out as soon as possible. This is frustrating and challenging, not only for the parents, but the superintendents and the schools that have to go through trying to develop plans and how they're going to respond to the guidance, but also for us who, again, work with the schools and work in the community trying to, again, develop and work through COVID response approaches. So we are waiting on the guidance to see exactly what that's going to look like. As I just mentioned with masks in general, we would advocate that we have some autonomy here. We went through this in the spring when the schools, obviously the state updated the guidance and put in a mandated masking policy. And then that obviously went through some iterations where then it was dropped outdoors in certain settings, those type of scenarios. We would advocate that at a minimum, we have some local autonomy from either the whole county level or school to school, where we could look at what's going on, look at the controls that may be in place in the school, and apply masks as appropriate and as needed. Not necessarily a full-on mandate, but obviously using social distancing and other interim controls as a way to help mitigate potential exposure and spread. What we did see last year throughout the entire school year is all of our schools did a great job. Again, it was very challenging working through this all the way back to last summer when the original requirements and regulations came out. But again, there was a lot of work being done. A lot of the schools went through a lot of different iterations of mitigation strategies, including barriers and again, all the distancing, the kind of social or the remote learning approaches. And, it was a lot of work. And then, and again, there were some schools that didn't have mask mandates because they were using distancing and barriers as appropriate techniques. So I believe that we should, approach it that way. Let's use the current data and look at the virus and the spread and what's going on and make decisions that match up with what we're seeing with the virus. And, again, we'd like to see some local autonomy there. Hopefully we'll get that guidance in the next week or two. Again, we're near the end of July already, and then we'll be able to work with the schools to put together what it's going to look like for the fall.
Great, Paul. Thank you. So, with vaccines being such a key component to slowing spread, where is the county? Do you have numbers on, the percentage of people that have been fully vaccinated, numbers that have, people that have only been one, and kind of what are the clinics looking like these days when you run them?
Yeah, so we're moving along. The progress has slowed down quite a bit. Again, it's interesting to watch how things flipped when the vaccines first became available right at the end of last year. As everybody's well aware, we had a huge demand and no vaccine. And it was literally, I still remember that week back in April, where we kind of were going from vaccinating 4, 5, 6, 700 people a week, and still kind of waiting on vaccine. And then all of a sudden it's like a switch went off, and we literally saw the demand drop off. And then obviously there was an excess of vaccine. So over the last 6, 8 weeks, a couple months, we've really seen that demand pretty anemic. There has not been a lot of folks seeking out the vaccine. We continue on the county health department side. We're offering vaccination clinics every week still. We've been vaccinating every week. Primarily back at the health department at this point. We've shut down our mass vaccination sites. But we do have them available primarily in Genesee County on Wednesdays in the afternoon. And I'd encourage folks to go to our website, gohealthnewyork.org. And we do have all of our vaccine clinics listed there. We're still going out into the community at various settings. We're trying to get over to, different concerts. We're looking to be, I think we're going to be over at the ball game this Saturday, actually offering vaccines, the farmers market, those type of scenarios. So we're going to be at the fair the whole last week of July. And we're offering all 3 vaccines. We have Johnson & Johnson, Pfizer, and Moderna. So depending on what people are looking for, and obviously the age groups, we do have those vaccines available. It's also readily available in the community at many pharmacies where you can either make appointments or walk in. And a lot of local providers are actually vaccinating now. So access and finding the vaccine locally is not a barrier. So we would encourage folks, again, to seek that out. Now is a great time to get vaccinated and protect yourself and your family. As far as numbers, we continue, as I mentioned, to uptick very slow here. But currently right now we're sitting at 28,405 who have their first dose or 1 dose of Johnson & Johnson. And then those that have completed their series in Genesee County, we're at 25,835. So percentage-wise, and again, this varies depending on what data set you look at. The state dashboard looks at 18 and older. We have regional data through the Rochester Rio that actually looks at 12 and older. So if you go 12 and older, which is obviously who's eligible to get the vaccine, first dose wise, Genesee County is at 56.8% vaccinated. And if you look at those that have completed the series 12 and older, we're at 51.7% of 12 and older. Again, depends on which vaccine data set you're looking at, but in general, we're just over 50% now of 12 and older that are vaccinated. One thing I do want to point out that is interesting, if you do look at the Rochester Rio's data set, so if you happen to want to Google and look at some local data, it does have a pretty nice breakdown demographically, for the entire Finger Lakes region, and you can drill down for Genesee County if you go to the Finger Lakes hub and look at their data. But an interesting point, if you look at severity and the ones that we're really concerned about with COVID in general, Genesee County has over 75% of our individuals 55 and older vaccinated. Our highest bucket is in the 75 to 84 year olds, and we're at about 85% vaccinated. So we've done very well as a community getting those folks vaccinated. Again, the ones that we saw with COVID were most susceptible. So we do have a ways to go, especially in the 12 to 45 range. But we have made a lot of progress in again, the senior populations.
Looking at the population as a whole, as I remember, kind of the goal was try to get 60 to 70% to have that herd immunity sort of barrier. It sounds like we're not there yet. How, two-part question: how much do you think locally, some of the misinformation about the vaccines is holding people back? And then, yesterday the Surgeon General put out a statement knocking the misinformation about vaccines. I wanted to get your reaction to that.
Yeah, I mean, misinformation is challenging. I think everybody has a right and ability to have their opinions and to, but everybody also should have the right to seek out and look for information, right, and make decisions that, are best suited towards them. Misinformation related to health issues can be a serious problem. If people, that's all they see and that's all they hear, they may be misinformed. They're not getting the full picture of potentially what the benefits and what the other side of the story may be. So we want to be very careful. We want to encourage folks to do research, to make sure they're doing everything in their ability to make an informed decision. We don't want someone just running out and knee-jerk reaction, doing things one way or the other. If you don't believe a person when they're saying the vaccines are safe, go research it out. Look at the CDC. Look at the FDA. Talk to your doctor. One of the best things we encourage people to do is talk to your primary care physician. They're usually a trusted source. There's someone in your community that you can talk to about your concerns. Everybody's different. I'm a firm believer and support that people should seek out information. They should do research and make a decision in the end that's best for them. And, we continue to support that. But misinformation is a concern, especially when it's not balanced and people don't have alternatives and ways to, really do research and make informed choices. It can cause a lot of confusion, mistrust, and fear, potentially anxiety to already a situation that's caused a lot of anxiety and mental health and behavioral issues. So, we want to make sure that, again, people have the ability to seek out that trusted information. And I would encourage folks, again, to go to, our website, go to the State Department of Health, the CDC, the FDA, and look at journals and research it and talk to your primary care physician. That's probably the best thing I can encourage folks to do, is to seek that out from a trusted source and then make decisions based on that.
Well, I appreciate your time. Is there any topics we haven't covered that you wanted to touch on?
No, I think we hit the highlights there. I mean, it's just one of those that we're just going to continue to be working hard here at the health department. Again, my staff are appreciative of the reprieve a little bit on the high case counts and large vaccination clinics. But we are here working. We're here making sure we're doing everything to keep up to date and keep pushing information as best we can of what's going on here in Genesee County. We're all very anxious and looking forward to seeing as things progress here through late summer into fall. But we need to continue to encourage people to seek out vaccinations. And again, if you're concerned about the vaccines, if you're concerned if it's right for you, talk to your doctor, seek out that medical advice, and then make the decision from there. All the vaccines are safe and effective at preventing COVID, reducing symptoms, and primarily keeping folks out of the hospital and keeping folks alive. I'd encourage folks to continue to practice their social distancing when able. Continue to wash your hands. That was one thing we learned a lot about, right? Washing hands, covering your mouth when you're coughing, and most importantly, staying home and staying out of the public if you're ill. So those general talking points, those different messages are things we're going to continue to push. But in general, we just need to continue to try to drive our vaccination rates up as high as we can now, so we'll be better positioned for the fall.
Thank you, Paul. One data point before we go, kind of want to lean on is, from what I'm reading, and you kind of mentioned this earlier, almost all the new cases, almost all the hospitalizations, almost all the deaths are among the unvaccinated. And I think that speaks a lot about how effective the vaccines are.
Yeah, absolutely. And we'll continue to monitor that and share that data. But it's definitely a strong indicator, right? And a strong data point to show that the vaccines are effective and they do work. And ultimately, we don't want anybody to get sick. We don't want people to be hospitalized. And unfortunately, we've seen 125 deaths here in Genesee County related to COVID. And we don't want to see anybody passing, relative to a disease that we have a vaccine that can prevent that.
Great, Paul. I appreciate your time.
Not a problem. Thank you.
So this is Howard Owens with the Batavian. We just completed a live stream interview with Paul Pettit, the Public Health Director. Appreciate all of you tuned in, or you'll be able to watch this at any time. And I hope you find it informative, and send us any questions you have. We can always follow up. Thanks.